you. We just wait for another 1 minute.
Yeah, sure.
We are live now.
Okay.
There's no people watching. Just wait a couple of minutes. Okay, good afternoon, ladies and gentlemen. Welcome. I am Akmal from the Sales, Marketing and Public Relations Department of Hospital Fatima Ipoh, and I'm pleased to announce to you that in conjunction with World Mental Health Day this year on 10th October 2021, we are collaborating with Great Eastern to spread mental health awareness by having live Facebook Talk today. The theme for this year's World Mental Health Day is Mental Health in an Unequal World. We are very pleased to have with us today Dr. Marvin Chong, our resident consultant psychiatrist, graduated from University Malaya 1998 and has vast psychiatric experiences both in training and practice, including general psychiatry, child psychiatry, counseling, psychotherapy, psychogeriatric, and community psychiatry. He is also a live member of MMA, Malaysia Psychiatric Association, being a committee member of PMPS, MEC Hospital Fatima, and a speaker to many CME and public talks. So it is our privilege to have Dr. Marvin Chong, who will share with us his immense expertise and experience on the aspects of mental health, especially in these times of COVID-19 with our audience today. The title of his talks is People's Mental Health, Are We Doing Enough? This talk is about 45 minutes and we will have another 50 minutes in our Q&A session immediately after the talk. So without further ado, it is my pleasure now to introduce to you Dr. Marvin Chong.
Thank you, Jack Hamas. In fact, I would like to thank the hospital management for inviting me to conduct these virtual meetings. Thank you for all the participants and attending for this afternoon's talks. For this year's World Mental Health campaigns, the theme is unequal treatments for the mental health. And today's my talks will be on the people's mental health. Are we doing enough? Are we doing enough for our mental health? For the publics, for the peoples, and especially during this pandemic period, there are many things we need to do, especially for the frontliners and also for the publics, for the peoples in the communities. So, are we doing enough for them? So, look at the mental health matters in the world. Normally, I take this America's mental health. They have good statistics. In fact, mental health awareness. Months fall in May, but now we have the mental health campaigns normally in the months of October. So the mental health days fall on the 10th of October each year. So look at the American statistic. There are 1 in 5 people experience mental illness each year, and a high number of them experience serious mental illness, 1 in 20, and over the millions of people are having mental illness such as schizophrenia, bipolar disorders, and major depressive disorders, and then high numbers of them live with anxiety disorders. So there are very high number of people are living with mental health problems in this world. And look at our countries. In fact, the demand of the mental health care rises, especially during this COVID pandemic periods. In fact, the President of Psychiatric Association pointed out that mental health care services, especially in private sectors, grown by an estimate of 30 to 50% during this movement controls orders, especially during this pandemic period. So more and more people are having the mental health issue or mental health problems in this period. Unfortunately, mental health still didn't get full attentions from the publics and also from the managed care, health managed care. That's why this year's mental health team is come out with unequal. Mental health is an unequal world. So because a lot of times the healthcare is more focused on the physical health and also or this communicable disease, especially during this pandemic. More and more focus is on the infectious conditions, and then less focus is on the mental health. In fact, you look at the budget for the mental health. Only 2% is allocated for the mental health case. So you can see the unequal distribution of the healthcare, especially for the mental health. In fact, the World Health Organizations realize that yeah, very wealthy become very wealthy. The number of people living in the poverty is still far too high, and then inequalities in race, ethnicity, sexual orientation, and gender identity, and the lack of respect for human rights in many countries, including people living with mental health conditions. So more so people with the mental health conditions, less and less, being paying attention by the people or being taken care of. And then the access to mental health services is still depend unequal. In fact, between 75 to 95% people with mental health disorder in the low and middle income countries are unable to access to mental health services at all. And then the access in high income countries is not much better as well. So even the high income countries, so the mental health services is not that. I mean the paying the special attention as well. So it's lack of investment in mental health is the disproportionate to the overall health budgets contributed to the mental health treatment gap. So it is that most people are focused on the physical health rather than the mental health, and even the countries mental health services also is focusing more on the physical illness rather than mental health illness. In fact, mental health illness is one of the non-communicable disorders, disease we need to pay attention on. Unfortunately, there's still a stigma and discrimination against mental health. In fact, mental stigma and discrimination can affect person's physical and mental health. In fact, not only against the mental health, but also affect the physical health, and also can affect the families and the loved ones because of these discriminations and stigmas, and somehow the also affects the educational opportunity and current and future earning and job prospects. In fact, when people heard of someone with mental health, they're less likely to engage the person or employ the person who has a history of mental illness. So in fact, the people with mental illness sometimes they try to hide their conditions or hide their illnesses, or even they have the illness in the past. They get well, they even they will not inform the others that they have mental illness or mental health problems because of this stigma and discriminations. Because if they inform the company they have mental illness, they're less likely to get the opportunity to get the job compared to the others. So, in fact, also this affect the education's opportunity as well. So, people who experience a physical illness, in fact, often experience psychological distress and mental health difficulties. Examples like people suffer from COVID infections. They also suffer from psychological distress and mental health issues. In fact, a lot of them have anxiety and depression as well. In fact, even other physical illness also, if the person has physical illness, they also tend to suffer from the psychological problems. Example like people with a terminal illness like cancer, not only because of the pain, the fear of the illness also affecting them. They cause them have anxiety and depressions. More so with this COVID 19 and pandemic, has further highlighted the effect of the inequality on the healthcare outcome in the on the nations, especially affecting the peoples in general. And it will continue to affect the people of all ages, actually in many ways. Whether it's the person get infections or the illness, or sometimes resulting in death, bringing a bereavement to the family members. And some family member also having suffer psychologically, and also they affect the economical, through the economical impacts with job losses and also continue the job insecurities. And with the physical distancing, that can lead to a social isolations. People withdrawn from each others, not meeting each others, and then lack of the social interactions. So this pandemic really affecting a lot of people psychologically. So a focus on mental health is all the more important in time of the pandemics. In fact, this COVID-19 has resulted in changes in not only macroeconomically and such as unemployment and financial insecurities and financial difficulty for a lot of people. Some people lost the employments, lost their jobs. Some lost their business. So affecting the finance economy. This eventually cause a distress not only to the person, to the family, to the people around. And then with along with the government's mandates for social distancing and isolation, quarantines, at homes, and lockdowns, so eventually also cause more psychological distress to many people. In fact, it caused a combustible miss for our generations. Cause the burnout, people get volatile emotions, distress. So it creates a tremendous stress to many people, and in fact, increase in the depression, anxiety, also alcohol use and suicide. In fact, this pandemic, some of the university did the surveys in the local. It showed that the increasing number of the depressions and also increase the number of anxiety disorder. Because some people, increase the taking the substance, abuse the substance, especially alcohol. Of course, also increase the suicidal rate. Just the recent news about this suicide rate is in Malaysia, because suicide is rising in Malaysia due to this hardship and because of this coronavirus pandemics. In fact, the numbers, from January to May this year is about 468. You can imagine within this 5 month period, it means almost 100 cases a month. So you can imagine, it can be 3 person committed suicide within a day. So there's a very high numbers of suicide during this pandemic period. This, in fact, affecting most of the state in Malaysia. And then also reported in many other states, the cases are getting higher because this pandemics. And this pandemics not only causing the illnesses increase like anxiety or depression, they also cause the distress in the family. In fact, more divorce cases during this pandemic period. In fact, our Prime Minister mentioned that in the Parliament that say there are almost 10,000 divorces involved non-Muslim couple, by almost 66,000 involved a Muslim between March last year until the August this year. So it also acknowledged that the pandemic and subsequent movement control order had led to the pressure on married couple and the family situations. And life under the new norms was seen to have impacted several aspects of life, especially family institutions. So this pandemic causing the vast stress to the mental health. So also affecting the relationships and the family's life. So it can cause the real stress to the people. So together with the stress, as well as the declaration of mental illness, resulting in significant function impairments. So this the mental illness not only cause the distress to a person, it also cause uh, social occupational functional impairments, and also can lead to increase in the the physical illnesses because of the stress. It also affect the body systems. So in fact, it can impact various functionings. So who are the people at the high risk to stress of a crisis like COVID-19? In fact, older people and the younger people, being affected most. Older people, they've been isolated, and then the children cannot visit them, they become isolated, social distancing from others, they have no interaction with other people, and similarly with young people, that especially there are the school periods being affected, school time being affected. They also lack the social interaction, lack the physical contact, lack the social interact or physical activities. So they are the ones being affected the most. And also people really have a mental illness, and also very likely get depression and anxiety. In fact, a lot of cases, they've been well, with the treatment, especially with the depression or anxiety, because this, the COVID the pandemics, because of fear of the illness, or they only get the illness, because of quarantines, isolation. Before that, they was well with the treatments, because of this, the COVID pandemic, given caused the illness, the relapse and recurrence. So that develops anxiety and depressions, and frontliners worker also they are handling patients to face these cases more, and also fear the getting illness, and then isolate from others, and then to distance from other people's, and they have more stress, and then long hours of work, so they also under tremendous emotional stress. In fact, this pandemic caused a person across the age span, have emotional stress. Especially people spend a lot of time on social media, so and then they're looking up for all the information about COVID, causing a lot of anxiety, and then the stress, and then the lack of social interaction with others. So in fact, it's affecting people across the age span and whole walk of life. Example, during this pandemic, the school children spend a lot of time on the social medias. So this is one example. The mother complains, the son, can't go to tuition center, spend a lot of time on playing online game, watching YouTube. So becomes addicted to the this yeah, computers game, and watching the game or watching the videos. So they won't spend time on studies, and then because of long hours spending on this social medias, so somehow affecting their also mental health. See. So what are some of the symptoms when people are at this state of crisis? A lot of them are having terrible insomnia. In fact, I do come across my patients. They were well during the normal days, but because of this pandemic, they also developed terrible insomnia because of fear and illness. Some of them, of course, went for the quarantine. They come out, they still have fear, anxiety, so they cannot sleep well, at night, and ruminating and then about the illness, thinking of the illness, so always fear, getting another infection again, check the number of them loss of appetite, cannot eat well, and also because of this loss of weight, and become withdrawn from the friends. Don't want to mix with people. Don't want to talk to people. Yes, they spend more time they just social medias, on their own, and then won't go out, and then even won't go for the exercise, so just withdrawn themselves, then number of them to complain, physical life symptoms like flu, in fact, even there's no infection, but they feel that they have the flu symptoms, they're so afraid that they might get COVID, so they're so preoccupied with the this the sickness, and there's a high number of them develops the mood symptom, and then mood symptom like depression, then the loss of interest, loss the joy, loss of happiness, feeling depressed, down, don't feel like doing anything, lost interest in their daily activities, and especially fear, fear of illness, fear of going out, and also with anxiety, a lot of anxiety, the symptoms, not only the fear, but also experience physical symptoms like palpitations, headache, giddiness, abdominal symptoms, loose stool, diarrhea, and also urinary symptoms. So they tend to develop the symptoms under this tremendous stress and crisis. So what's the role? What our role? How can we help people? What can we do? So what we supposed to help people with this distress? Maybe the family peoples, the friends, the relative, or even the healthcare professionals, can provide more time, for people with suffering mental health problems, and talk to them, to find out what they're having, maybe can come up with a more definite diagnosis for the persons having mental health problems. You also need to screen for any people with suicidal thought, especially this period. So you need the time to talk to them, spend time, for the people suffering from mental health issue. Try to understand their stress and the cause. Try to identify what's the cause. Not just because of this pandemics. Maybe they have financial problem, relationship problem, relationship issue. Make sure people know, where there are treatment. There are treatment out there available. A lot of people were not aware that maybe there are help out there, provided, and also let them be aware, there are such a treatment available, such service available. So we need to provide access to a treatment for mental health, especially. So there's a question: are we doing enough? Are we providing enough mental health services for the people? So we need to create awareness, so that the people are aware where to seek help, where to get services for the mental health issue. So we also must let people suffer from mental health problems to understand that they are not alone. So we are not alone. A lot of people are having mental health issue. So not just people with anxiety or depressions. In fact, I can say everybody also have mental health issue at this junction, at this period. Whether it's a minor mental health issue or a major mental health issue. So we must know that we are not alone. So we need to build the resilience and also the hope. We need to have a hope for life. So how do we build the resilience? What's the resilience between the mental health? So resilience also refer to the process of adapting well in the face of adversity, trauma, tragedy, threats, or even significant source of stress. Especially, the stress in the pandemic period, the crisis. Resilience also help us to protect from various mental health conditions such as depression and anxiety. And emotion resilience refer to one's ability to adapt to stressful situations or crisis. And most resilient people are able to roll with the punches and adapt to the adversity without lasting difficulty. And then less resilient people have a harder time with stress and life changes. both major and minor. So we need to build our resilience, how to overcome this adversity, face the adversity, and then prevent the mental health problems. So how are we going to build our resilience? We need to build our own resilience. So we need to accept, because some sources of stress are unavoidable. You can prevent and change a stressor, such as the death or of loved one, or serious illness, or work crisis. Because we can't change all this. In such case, the best way is to cope with stress, is to accept things as they are. So we can't change this pandemics, the periods. So the best way we learn how to cope with, to accept the things as they are. See? Of course, acceptance may be difficult, sometimes, but in long run, it might help you to go through, the cope better. See? Sometimes we may have no choice, but to accept things the way they are. See? Let go the anger and the frustration, the resentment, free yourself from all the negative energy, and by forgiving and moving on. See? We need to move on with the life. And accepting the circumstances, that cannot be changed, and can have you focus on the circumstances that you are, you can order, or you can do some things, Of course, you also do need to adapt, learn to adapt, this new crisis. The live with the world is to adapt constantly, because almost 2 years after the COVID-19 pandemic has emerged, we have been forced to adapt to a new norms. Work from home setting, and then parents homeschooling their children, in a new plans of the learning setting, So the teacher, the children also, they have to they learn from home. See, so you have to adapt to the lockdown and quarantines, and the mandatory wearing of the face mask, and then also the face shield in the public. All these changes we need to adapt. However, all changes require some sort of adaptation. We need to learn to adapt. Of course, it's not so simple. Of course, you need to ask ourselves, would this matter in a year or in 5 years? Of course, the answer is often no. Try looking at your situation from a new point. Instead of feeling frustrated, you are forced to adapt to new changes. Because adaptive resilience is the ability to recover from the adversities. So you need to adapt and drive to change it, to face these circumstances, adversities. Of course, you need to make a lot of adjustment in your life. In this pandemic, they taught us the unexpected, and follow the guidelines as they take on the new measures. So having experienced so much traumatic changes, it may be difficult or even unbearable to think about experiencing any more shift. So we all want our normal routine back. You are not alone in that. So you need to adjust. So adjustment is a process that looks different for most people. This process is not easy. So you need patience and flexibility, to adjust to new norms. So it's okay, to set a new adjustment. So you adjust accordingly. Give yourself some extra rest, and be a little more cautious with your energy and what you are taking each day. To learn how to adjust. And also, of course, you need to act. The ability to act in the face of adversities, and constraints. Act on the adverse situations as much as you can. Take decisive action rather than detaching completely from the problems and these stresses, and wishing that it will just go away. So we cannot just detach ourselves, say, no, this thing will go away. It might not go away. So we need to take a step. So the capacity to make realistic plans and take steps to carry out, and develop some realistic goals. Do something regularly, even it seems like a small accomplishment that enable you to move forward your goals. So take one step at a time, to act on it. So you need to at once move on. So people often learn something about themselves. They may find that they have grown in some respect as a result of the struggle with crisis. So many people, who have experienced tragedies and even feeling vulnerable and increased sense of self-worth. And one is for us to develop a spiritually and heightened appreciation of our life. So we have to move forward. So maybe have to improve our relationship, get to know others, interact with others more, so we in the achievement. So it's not easy, to you need to to build your this resilience. Of course, you need to to practice it, to talk to people, and also act on it. And, and the others, the way of building resilience is learn how to change, take the change, change ourselves. So you have to accept uh, accept things, accept changes, because accept change is a part of the life. You can't change the fact that highly stressful event happened, but you can change yourself to interpret and respond to these events. And changes are stressful, of course. It's not, you need to require to adjust and adapt. And because experiencing too many changes can be stressful, but we need to find way to cope with it, and then take charge. And learn how to cope, because thinking you cannot cope is one of the greatest stressor. You think that you can't cope with life, In fact, coping involves adjusting to unusual demands, and also stressors. So this requires giving a greater effort and using a greater energy, than what is needed in the daily routine of life. Of course, some coping mechanism you can do, and you use it to challenge, is lower your expectation, ask others to help, assist, take responsibility, for the situations, maybe engage in the problem solving, way, maintain emotional supportive relationship, also, challenge the previously hope, belief that are no longer adaptive, and then directly attempt to change or the source of stress, distance yourself from the source of stress, But in pandemic you can't avoid some of the stress, so you have to face it, then view the problems through a religious perspective, and also of course, you have to. The coping is a process. Maybe you have to try certain way, how to relieve the stress by doing this, to learn how to cope, especially try to get enough sleep, and also eat well, sleep well, exercise on a regular basis, take a big period for the relax, so you have to engage in some activity, daily activities, this way of the learning how to cope, maybe the stress. And of course, the resilience also, we learn how to control the situations, because many things in life are beyond our control. As example, like COVID pandemics. But rather than stressing out over it, we need to focus on the things you can control, such as the way you choose to react to a problem, the capacity to manage, strong feelings, and also impulses. You have to develop your own confidence, your ability to solve problems, and trusting your instinct, to help to build your resilience, and a positive, view of yourself, confident in your strength and ability, to control, the situations. Of course, you need to take this, the crisis as a major challenges, try to look at them as an opportunity for personal growth. If your own poor choices contribute to your stressful situation, try to reflect on them, learn how to overcome the mistake. Try to looking beyond the present, to how the future circumstances may be a little better. So, and look at this as an opportunity, as a enable you to expect that good things will happen in your life. And try to visualizing, what you want, and then rather than worrying about what you fear of. So you take this as the challenge, rather than the fear. And then the most important, is the connections. Try to connect with others. Because there is nothing more calming, and then spending quality time with another human being. So you spend time with others will make you, feel safe and understood. Face to face, interaction, of course, can help you. But with the this social distancing, and then of course, maybe you have to use other means of connect with others, talk to others, because keep in mind that people you talk to don't have to be able to fix your stresses, but there's simply need to be good listeners, and try not to let worries about looking weak, by talking to other people, by talking to others, by help you to relieve some of the stress. Of course, no, you can make phone call, mm, uh, nowadays with the good communications, the uh, media, you can use it like Skype, WeChat, WhatsApp. There's so many means can help you to connect with others. Because by doing that, expressing what you are going through can be very cathartic, to help you to relieve the psychological stress. Even there's nothing, you can do about it. And with this situation, but talk to a trusted friend or make an appointment with a therapist might help, to help you. So accepting help, support from those who are care, about you, will listen to your listen to to you, will help you to build your resilience towards the mental health. Of course, some people find that being active in the civics groups and provide social support and can help with reclaiming hope. So assessing others in their time also need also can benefit the helpers. So sometimes you talk to others, not need to help yourself. Mm. You also help others, by coping. So of course the key is to identify the way, that are likely to work for you as a part of your own personal strategy, for fostering the resilience. Because there are many ways, I mentioned, you have to find another one way, good work for you, because as life has been quick to change its circumstances, and many of us may neglect to process our emotions. Because some people may feel, frightened over the restriction or guilty over returning to a new norms. Some may be excited to attend a social gathering, and for others, that thought trigger the anxieties. First, foremost, you must understand there's a mixed emotion and feeling. Yeah, it's the norms. It's a valid. It makes sense. You have to mix the emotion. So be patient with ourselves and open to what we are feeling. And then if you are, experience any distress about returning to life, post pandemic, and if your symptoms are disrupting your daily functioning, you may want to consider seeking outside support and also guidance. So therapy option, including the virtual section, maybe available, uh, also can help you. So I like this one, actually developed by this, the doctors in Kenya, this is a useful vir- virtual, that share how you have to walk out, want to, walk out during this pandemic times. So what to do, what you want to do. So of course, when they started having this COVID, a lot of people having fear, so they are living in the fear zone, fear of getting sickness, fear, the situation, fear, this, the lockdown, So there's a learning zone, help her to learn, and then the growth, so help her to growth, from the, get away from this, the pandemics, and the action zone, what we can do, how you act, how to help others, doing some, work in the society, helping people in the society. It's a civic, groups, actions, So this will help you to, to get away from this, pandemics, and build up your, the resilience also, and overcome your emotional problem, mental health problems, by walking away from this pandemics. So this is a time, maybe we should invest in this, the mental health. What you should do, how to help yourself, help others, in terms of the promoting the mental health. Of course, in Malaysia also, the number of psychiatrists are very few. Only it's about 500 in the whole country. So they're dealing to how many millions of the population, 30 over million population. In fact, one psychiatrist had to deal with 100,000 population. So this not follow the World Health Organization's standard. World Health Organization standard it should be 1 in 10,000. You can imagine how short a psychiatrist. So we hope to the Malaysian GP also can take up the role, have the mental health care, so they make it more accessible. So in fact, the Malaysian Psychiatric Association and also of course others NGO also try to promote this mental health care in the society, especially with the number of GP in the society, you can help out, so to make it more accessible to people to seek mental health services. Of course, World Health Organization during this pandemic also come with very good this mental health infography. I think some of you may encounter it or has seen it. This is how to help it public to go through this mental health. So you want to know more, I think you can go through this this infographics in the published in the WHO COVID-19 mental health. So it's not only for the public, but also for the frontliners to help them how to cope with the mental health issue. So I hope with this talks to enlighten some of the mental health issue encountered in this pandemic period, and then how to help the people to go through the mental health the problems and the stress in the mental health. Then I would like to thank you for participating in this talks and also attending the talks. Thank you.
Okay, thank you, Dr. Marvin Chong. Now we will have our Q&A session. Okay, let's start with our first questions from the audience. This is very interesting questions. This questions was asked from Amar Ashraf. Hi, doctor. I want to ask a question regarding mental issue. Can you explain more about Munchausen syndrome by proxy? My friend told me about his mother that are experiencing this mental illness. Actually, Dr. Marvin, I did a quick Google about Munchausen syndrome. It's when someone tries to get attention and sympathy by falsifying an illness. So, can you explain further about this, doctor?
That's very interesting. The topic on this Munchausen syndrome. Munchausen syndrome, of course, can happen to a person. People tend to make up the sickness, physical illness. They want to to get the attention from the healthcare, like doctors. They will see doctor. Like example, they don't have fever. Maybe they make up a fever, say they have fever. So they want to get the attention to see a doctor. In fact, the lady can produce a fever. They make the body warm.
Oh, I see.
So this is the block by proxy. That means the mother make the child have symptoms. The physical symptoms, so that they can bring the child to see the doctors. So it can be the psychological symptom of the mother itself, rather than because the child. So sometimes they need the attention from the healthcare personnel. So the syndrome can be many things. That's why they call syndrome. They can be many other symptoms. Physical presentations. Can be pain. They can be real. Says they can even bite the tongue for this. The the blood. So they say they cough up the blood, you see. So that they say that flame, but not that the blood. So they need to see a doctor, so they can produce the symptoms or signs
I
to
see.
seek help. So actually, they need medical attention in such way.
I see. Okay, thank you, Doctor. So we go to the next question. This is from Jin Hui Eng. Hi, Doctor. May I know how to move on from a really bad divorce? I am asking on behalf of my friend who is having depression post-divorce.
All right.
So this is also interesting topic,
Yeah,
Doctor. So any
that's
advice from you?
Yeah, I can say that. Of course, now people now face the divorce, marital problem. They do get depression, and to get depressions. Sometimes the depression, even before the divorce, already having depressions, having the depressive symptoms. So of course, it's advisable the person to talk to maybe the therapist, the counselor, any psychologist can conduct the therapies. Of course, if you come to a clinical depression, then you need to seek the medical help, Need sometimes you need medication, antidepressants. Beside the psychotherapy, maybe you need antidepressant to help you to go through the depressions. So you look, you consult the professional help, to find out see whether you have clinical depression, and
I
also
see.
you can.
Okay, Doctor. So we go to the third question. It's from Amar Akim. Is medication needed for a bad depression?
Okay. When talk about depression, I believe that you're talking about quite a serious depression. When you come to serious depression, normally we need to give the medication for the person to go through the depressed period, because medication to help them to come out from the depression. So then, because when you're so depressed, when you want to talk it out also, as a talk therapy, it's not easy to go away sometimes, with the bad depression. So maybe you get a medication first, get treatment first. After that, you can also have the talk therapy, or psychotherapy, to help you.
I see. Okay. Thank you, Doctor, for the explanation. In view, there are no further questions, so we will wrap this session.
Oh,
So, thank you, Dr. Marvin. I am sure you have all enjoyed this very informative talk. Thank
thank
you,
you.
everyone, for watching. So, we have now come to an end of this talk, but nevertheless, not the end of our activities, as we invite you to further join us in another Facebook Live talk on Wednesday, 27 November at lunchtime, 1 to 2 p.m. To tune into our talk on breast cancer, the fight begins with awareness by Dr. Sapinan Mak, our resident consultant general and bariatric surgeon. Please follow and like our Instagram and Facebook for more information. Thank you. Keep safe and stay healthy. Have a good weekend, everyone. Bye.
Thank you. Bye.
Bye. Bye, Doctor.